Hi there. I have been really excited about doing this show. This is interesting because Regina and I just met. This is Regina Hufnagel, and we just met, and it's like been a huge long road for both of us. And actually, it's been a huge long road for both the Libertarian Party and also for Law Enforcement Action Partnership. They were founded in 2002. And much like us, they frequently face like a media blackout. So the first thing you need to do is like, comment, share, because thanks to social media, we have at least a little bit of chance of getting Leap's message out. And Regina is here with us tonight to help explain a subset of their message. They actually cover quite a lot. But I should introduce Regina. So Regina, you joined the Army Military Police Corps in 1996. Is that right?
Yeah.
How?
Thanks, Rob. So I actually, part of growing up, I just always thought that I wanted to be in law enforcement because I thought that law enforcement was the good guys and they made people safer. And I still actually believe that, but some things have changed. So after I joined the Army Military Police Corps when I was a junior in high school, I was actually for a year, and then I did that. We deployed in 2000, 2001, and then when I came back, my time was up, and I started working for the Federal Bureau of Prisons as one step in my long-term goal.
Right.
And some of the things that I noticed when I worked in a prison was we have these like sentencing disparities that I was noticing every day. So I worked in the receiving and discharge department. So we were responsible for adding and releasing inmates, coordinating their movement all over the nation with the U.S. Marshals and other various organizations. And I started to notice that the days, like in the morning when I would release the inmates, there'd be a couple of white guys who had done like 3 years for child molestation. And I thought that that was a disproportionately short sentence for child molestation. And then there'd be a couple of black guys who had done like 15, 20 years for possession and possession with intent to distribute. Pick one.
Wow.
And if you read their lists of charges that go on for an entire lifetime, it's this constant, chronic, repetitious situation. But also, we know for sure that there are no races, all across all races, they use drugs at the same rate. But we're seeing this disproportionately high amount of Black people who are incarcerated for it compared to whites. So my first thought process was, so we have got these inmates who they have actual physical victims and they're children. And this is something that for many people it's a really visceral response. And then finding out that they only get 3 years for that gives you pause.
Right. How long is the child going to have to live with that again?
So this is the kicker. So the Federal Bureau of Prisons actually started a sex offender management and sex offender treatment program, largely due to the outrage of the citizenry that they are incarcerated for as long as they are, and they're not getting any type of counseling, any type of behavior modification. So we started these two programs, and what we found out was that for every one physical victim that we knew about, there was on average 7 that we didn't.
Wow.
So that's jaw-dropping. That's really eye-opening.
Yes.
So it actually worked out in terms of data collection. It worked out really well for us because we learned a lot about their behavior and a lot about how it is that they're able to accomplish the things that they are able to accomplish. But then, back to the whole sentencing disparity thing, I just thought, it's not sitting well with me. And then I later found out that the lifetime likelihood of a white male to go to prison is 1 in 17. The lifetime likelihood of a Black male to go to prison is 1 in 3. And I thought that was off as well.
Yeah.
So after many years,
frankly, though, actually, both of those numbers are kind of disturbingly high for me. One in 17. I mean, just call it 1 in 20. What, like 1 in 20 people go to prison? I'm not actually happy. That's 5%, folks. We got to do better than that right out of the gate. And then, did you say 1 in 3?
1 in 3.
1 in 3.
Yeah.
That's in flipping insane.
Yeah. Yeah.
So get together with 2 of your friends. One of y'all's going to prison.
Yeah. And imagine growing up like that, because we know that the war on drugs disproportionately affecting minorities and minority communities, specifically
Right.
this becomes this cycle of, once somebody goes to prison, if they're a felon, it becomes incredibly difficult for them to get a job, an apartment,
Sure.
a college education. And if they've got kids, if you were a child who grew up and you had a parent who was in prison, that increases your chances of going to prison simply by associating with that life and that lifestyle. And if you live in an entire community where all of the dads are in prison, that's the
Right.
community that you live in. And so you think that that's normal. And so if you look at generation after generation, the war on drugs, which, like I said, disproportionately affects this community of people, it does it for generation after generation after generation. And also, if you're a child who grows up in that situation, you have a much higher likelihood of food scarcity, poverty, low education, not going to school because you have nobody there to parent you to make you go to school. And then they end up selling drugs too. So it's just this vicious cycle that keeps them down.
But let's back up and why do you finger the war on drugs on that? I mean, what if someone, what would you say to someone who argues, well, if it wasn't drugs they were arrested for, it'd be something else? It's just, why is the war on drugs significant? Why isn't it incidental?
Okay, so part of the war on drugs is that it's not just the drug that is the crime. It's the theft that goes with the crime. It's the gang wars that goes with the crime. It's all of the other crime that goes with the war on drugs. So
because of the black market it creates?
Well, so we like to call it the illicit market.
Okay. That's very fair. That's very fair. The illicit market. I will pick that up.
Okay. So indeed, you have this illicit market. So let's back this up for a second. When things are legal, you're not fighting over them. You don't go to the grocery store and see the Bud Light guy stocking next to the Miller Lite guy and getting in a fist fight and shooting each other, because it's legal and it's regulated and everybody has their place on the shelf. But when you're in an illicit, unregulated market, you have turf wars, you have gang territory, you have various different degrees and levels of things that have to happen in this type of marketplace. And this unregulated market, which in and of itself is dangerous, it also leads to people who are addicted. They have substance use disorder. They have opioid use disorder. They're consuming unregulated marketplace substances that are laced with horrible things, in addition to things like fentanyl. And this is then what is leading to part of our opioid epidemic in the United States.
Right. Yeah, I was going to point out, if you get a bad Bud Light, you have a recourse. If you get a bad batch of an illegal narcotic, if you're going to do something about it, it's going to be a personal confrontation.
And then think about this. So in addition to having this massive opioid crisis that we have in the United States, it's then taking away police resources. So this is the other danger of the situation, is that, we want law enforcement to be able to protect us and to be able to respond to us when we need them. And unfortunately, every night they're giving dose after dose after dose of Narcan, because in some parts of the United States, this is all they do every single night, hand in hand with other first responders, just rescuing people from overdose. So if you or I call because someone's breaking into our house, well, sorry, they're all tied up with the opioid epidemic.
Right. So I want to show people what a mess this is. And I think this was, let me fix the size of this just a little bit. I thought this was a great graphic that Leap put together. So I call this the war on drug tree. I don't know what you guys reference it as, but I love this because it shows the war on drugs down here at the roots, and then it shows all these things we were just talking about and then some. And like my first idea for this interview is I was like, Regina, let's just explain the war on drug tree. We'll just kind of navigate through it. And she's like, well, we can't do that. It would take like 8 hours. And I'm like a Ken Burns fan. Like I like the Ken Burns documentary on the Civil War. So I thought about it for a second, but no, Regina's right. We have to scale this back a little. But maybe she'll come back if we treat her nice. But so
we've touched on a great many of these already, and we only started a few minutes ago.
Right.
Talked about wasted police resources because they're not being deployed properly.
Right.
And it's a public health problem, this opioid epidemic. And one of the things that they're talking about with this defund police is actually, it's pretty similar to the stuff that we've actually been talking about. We don't call it defund the police. We talk about how we need to reinvest our money into community resources because law enforcement is not the right entity to be dealing with health problems. You show up to a situation with an overdose with a gun. You need somebody who has mental health training and physical health training to be able to deal with those sorts of things. And so it's actually one of the things that they're talking about. And so we look at it as, why don't you refund the community? Take all the money that you are putting towards the war on drugs and take it away from the police because the police aren't using it correctly because they're not trained to use it correctly and it's not part of their function, and give it to those who can respond properly to the situation, which would then free up the police to be able to actually go do their jobs. If you look at the statistics, since the war on drugs started, the crime solved rate since the 1960s continues to plummet. If you are a victim of assault or armed robbery or a carjacking or attempted murder, the likelihood that police solve that crime has been consistently lower and lower and lower because they don't have resources to be able to investigate it because they're dealing with the war on drugs.
Right. So yeah, I mean it's sort of analogous to what I tell people sometime about taxes. Is everybody wants to pay less on taxes, and to me, I like to focus more on doing less harm with the taxes. So I mean, right now, people are saying defunding. They're talking about defunding the police, but what they're missing is there's actually a lot of law enforcement that wants to sort of decrease the scope of what they're responsible for. They want to. There's a lot of law enforcement that actually wants to focus on going and finding the bad guys, which works for me. That's kind of what I want them for.
Yeah. So here's other harm reduction examples that we've been asking for forever is supervised injection facilities. Recently rebranded as overdose prevention facilities. And really what it does is it takes the current system of use and it just reconfigures the system. So what you have now is you have people who are homeless, or they're not homeless, but a lot of them are, and they go hide behind dumpsters or they lock themselves in fast food bathrooms. They're all alone. And in seconds they overdose and there's no one there to help them. And then police are called and police are going all over the city, all over the county to be able to respond to these situations. And if you had an overdose prevention center, which effectively brings all of those people together in a very safe, controlled environment where they have medical staff there to treat them immediately if they start to overdose, there's an ambulance right outside to take them to the hospital. So instead of deploying law enforcement all over the place to go get to these people, they're all in a safe space. So we've actually found that for every $1 that you spend on a supervised injection facility, you save $5 across the entire system per person.
Now, I take it it's absolutely taboo for the injection facility to supply the drug?
They don't supply the drug, but they supply all of the paraphernalia. So that means it's safe. It's sterile. They are reducing soft tissue injections. They're reducing HIV, AIDS, and Hep C transmission. The other thing that's really important is they're gaining the trust of the drug-using community, which allows them to then get in there and say, we are here to help you when you're ready. You don't have to live like this. We have the resources that you need. Just let us know when you're ready. So how many times are they saving somebody's life? Often, I will tell you it's often, but in the roughly 100 overdose prevention facilities that they have in the world, there has never been an overdose death ever in the history of a supervised injection facility.
That is incredible. Yep. Absolutely incredible. And you know, a thing and I think this is kind of a mistake on my part, is for years I've been pointing out to people, you can't save people from themselves, which I think is absolutely true. If a person wants to destroy themselves, they're absolutely going to, but it fails to supply a solution. It fails to supply the next step forward. And, you know, that's what you just said is after gaining their trust, you know, you can connect them to facilities so that they can get help. And, you know, what I hear that as is, okay, you can't save a person from themselves, but you can be there for them to help them when they're ready to save themselves.
Right.
And that's the thing. You got to be with them on that journey, and you have to build that trust. You can't just throw them in a freaking cage. It's not going to work. You're the bad guy. They're not going to work with you.
Well, in addition to that, we also know that there's no dearth of drugs in a prison. There are plenty of people who go to prison and they get addicted to drugs while they're in prison. Because if I was, I'd be doing a ton of drugs. Let's be honest. So, prison is not the place that you go often to stop using drugs. They're everywhere. Right. So if we can't regulate them properly on the streets and we can't regulate them properly in a prison, we're fighting a losing battle, and it costs trillions of dollars a year.
Absolutely. And, you know, another thing we hear with the recent discussion is police is they need better training. They need better training. They need better training. They need better training. So I would imagine this would allow them to be more focused on the right training, or how do you see this playing in?
So there's a couple of things here, right? So if you're going to make them the front lines of the war on drugs, which means they have to be mental health professionals, they have to be medical health professionals, and they also need to manage the law, then yeah, they need a lot more training, because they're the ones who are showing up to calls where somebody is having a psychotic break and they're wielding a hammer. And if that happens, they tase them, they spray them, they shoot them. That's not the right way to deal with a mental health breakdown. You should have a mental health professional there. You can escalate that situation if you're properly trained. So if you want to keep that in their wheelhouse, then yeah, they need proper training. If you're talking about the opioid epidemic and you're talking about drug overdoses and you're talking about how these people need therapy, well, now they need to become therapists too. So it's simply a matter of divesting these two things from the one thing that they really should be doing, and then allocating resources to those who are the right fit for them.
So when we talk about the illicit drug market, I often argue that, and I think this diagram does too. Oh, look, I made it too small again. You get back to the discussion of police militarization, because if you're going to be dealing with the illicit drug market, you know, this gets back to the Bud Light and the Coors guy. I can't remember which two guys. I don't know. I'm a bourbon guy. If you'd picked bourbons, I would have remembered them. But you know, the police don't need to be all armed up to deal with them. And there are actually regulations still around alcohol, but it's not like prohibition. You know, in the prohibition days, law enforcement had to be heavily armed to deal with the drug gangs, and they still weren't keeping up. Or sorry, the alcohol gangs. And the same thing goes on today, right?
Well, it's the exact same thing. If you studied alcohol prohibition, that was done after 11 years because we realized as a society what a terrible idea that was.
Right.
And then we turned around and we did it a few years later with the war on drugs, and everything that happened during alcohol prohibition has repeated itself with drug prohibition. Just because you tell somebody they can't do something doesn't mean they're not going to do it. They're just going to do it in the illicit underground market. And because they're trying to get away with it. So for example, during alcohol prohibition, drunk driving incidences increased 500% in the first year of alcohol prohibition.
Wow.
It's not that more people were drinking. It's that they, in an effort to hide it so they didn't get caught, then they were in an effort to hide their behavior so they didn't get caught, they were then getting in accidents because they were doing it unsafely, which is the exact same thing with the war on drugs.
And last time we figured out in 11 years, and this time it's taking us like 40 so far. Is that about right? 40,
Yeah.
50?
Yeah.
It sounds like we're learning slower. I'm going to blame the Department of Education for that, but that's an entirely different guess. So I won't drag you there.
I don't know if it's that we're learning slower. I think that it's the presentation and the rhetoric. You know, it's this constant idea that if we just try harder and if we just put more money towards it, it'll get better. And based on the way it's been presented to us by, you know, the media and politicians, and the way it's all of the rhetoric and it's the presentation, and it's also it's the constant use of the word war. We are at war, and you're like, are we? I don't know that we need to fight this as a war. We need to deal with it differently.
Well, a war is something that tells people we have to put unlimited resources in it. We have to win this at all cost. And I feel like just about every time you say we have to do something at all cost, it's probably a mistake. I mean, there is some finite amount of cost where you need to go, nah, never mind. And, you know, we should have done that with the war on drugs a long time ago. But it reminds me, I used to work with a ex-FBI guy, and I was working in Vegas at the time. And he was all excited because his FBI buddies busted like 100 drug dealers in one massive bust. And I think it was cocaine. I can't remember the drug, but I'm like, wow, that is a big arrest. And he's like, yeah, it is. And I said, how much do you think that's going to impact the price of cocaine? He goes, I don't know, but I would imagine, well, he thought the opposite. He thought it would go up a little. And I said, well, if the price goes up, won't that invite more people into the market to try to make money? He's like, well, yeah, I guess it would. I'm like, so when you arrested those 100 people, how many new people did you invite into the market? How many new drug dealers did you create? He goes, well, I don't know. I said, well, don't you think somebody should have figured that out before you went and arrested them?
Everything that you're talking about, this is shocking, right? So what we don't realize is that the true free market is actually the drug market,
Right.
and so price varies based on supply and demand, and so the suppliers know to calculate for drug seizures. So the amount of heroin that is used in the United States every year actually fits in an 18-wheeler. That's it.
Wow.
It's small, it's packaged so small, they can fit the entire amount for a year in one 18-wheeler for the United States. And so they calculate in that some of that is going to be seized. So they ship 3 18-wheelers in for the year, knowing that 2 of them are going to be seized, and it doesn't affect the price of the one that they need to be able to supply the people who need it.
Right.
It's well calculated.
We're at war with the supply demand curve. We're at war with math. We're just going to lose. Sorry. Get over it.
The other thing too is that there's no shortage of low-level dealers.
Right.
You know, tons of people are trying to make money and get into the game, and so as soon as they find a street corner that's empty, they're like, "Hey, man, I'll take that street corner."
Sure.
And until you can get the really, really high level suppliers, which is really difficult to get, you're not making a dent. If you seized $20 million worth of heroin or cocaine, it's not actually that much.
Wow. Regina, I think we actually covered everything we set out to this time. Did we not? I think we got it all. Regina sent me some bullet points so I could remember, and it's not, I've never even tried marijuana. It's not because I've lost my short-term memory from marijuana. I'm just too many years of coding. It's all spent there. It's all gone.
I gotta say, as somebody who worked really hard to legalize adult use cannabis in Massachusetts for recreational purposes,
Yeah.
you know, one of the reasons for that is because of the war on drugs and how it disproportionately affects minorities. That was
Absolutely.
one of the reasons. We've, as a result of legalizing cannabis, we've actually seen some really great effects in our criminal justice system.
That's great.
So dismantling the war on drugs piece by piece has actually worked out really well. And if you're paying attention to what's going on in the marketplace, and in some states they're legalizing things like shrooms and LSD and all sorts of other hallucinogenic or entheogenic drugs, it's actually working out piece by piece. So we got to come at it from a lot of different angles, and LEAP is really doing a very good job.
Yep. And one of the things I always try to do is I try to remind people to go to perry4ky.com/candidates. You can see all of LPKY's candidates there, and that includes a lot of state level candidates. And we just missed even getting legalization of edible marijuana for medical use this year. We're not even there in Kentucky yet.
Mm-hmm.
So, and I mean, that's a whole different, well, it's related, but it's a whole different war, because it's like, it's one thing if you're myopic enough to not realize you're doing harm instead of good, but really you're standing between a patient and a doctor's recommendation and a frickin' plant. I'm sorry, I just don't have any empathy for that. Just seriously, get out of the way. So we have several candidates that are running for state level offices. So we need those people in Frankfort. Please go support those people. Of course, one of those is Amanda Billings, who's running against, I think his name was Whitney Chesterfield. He was the gentleman who was in charge of the Judiciary Committee, who did not allow the bill to even be considered. It was passed in the House, and he wouldn't even consider it in the Judicial Committee. He stopped it. So for the love of God, go vote that man out of office. If other people in that committee want to vote against it, I'm fine with people standing wherever they stand, but man, don't just as one person stand in the way of people getting help. And as voters, this is your chance to change that. So go find Amanda Billings on my candidates page. Go support Amanda, but she needs all her peers there. We need everybody we can in Frankfort who understands this. And of course, I'm willing to go to DC if you want to send me, so you can support me too. If you have more questions for Regina, feel free to ping me and I'll pass them on to her. And if we get a bunch of them and we ask nice, maybe she'll come back and talk to us some more. But Regina's really passionate about that. And that's the thing that's missed. There are a lot of law enforcement officers who are passionate about this, like our own David Patterson, who ran against Mitch McConnell in 2014. And, we need to get the word out. So seriously, like, comment, share, get this thing out, because these people are being blockaded by media the same as we are, and social media is our way around it. So get it out to everyone you can. Thank you. Have a good evening. Thank you so much for joining us, Regina, and thank you for fighting the good fight, and trying to move our country past this grievous error. Have a good night.